Anyway, he did verbalize it to his parents, which is a good sign, and he was hospitalized. No other hospitalizations. He had a therapist in the past, but has not had any therapist recently. And currently he's being treated with Prozac, 20 milligrams for the past 2 weeks. Feels it's not ineffective. Also, he's on a hypertension medication. His only medical condition that he reports is hypertension. No known drug allergies. Father has history of alcohol abuse, probably dependence. Mother, same, at least alcoholism. Anxious, also, and some anxiety. And he currently is sounds he's mostly isolative in a virtual world interest. Some violent. I don't know these games, but it sounds like warlord, or there's probably some violence associated with him. However, he lives this sort of life seems like his closest contacts really. He stays in touch with his parents occasionally, and a cousin. But otherwise, sounds like he mostly keeps to himself except for the computer. He denies any physical or sexual abuse. He basically presents as maybe about a stated age, has good eye contact, seems well groomed. He doesn't have any significant psychomotor agitation or retardation. I saw no unusual movements. He has his speech was good initiation, clear, logical, coherent. Good to fair initiation. He mostly answered my questions, but he did add some. He has his mood he describes as being depressed, and his affect is mood congruent. Almost, I would say, constricted range. His thoughts are clear, logical, coherent, with no evidence of tangentiality or circumstantiality. I believe he does have paranoid ideations and paranoid delusions. He denies any auditory visual hallucinations, and he denies any suicidal, homicidal ideation. So, in summary, he's a 40-year-old male who has a family history significant for alcohol abuse, some potential anxiety disorder, who's been treated for, it sounds as though, some depression and hypertension, and he does not have any therapists, and sounds like he's mostly not using coping strategies other than retreating to the computer. At this point, he has fair insight and fair judgment. And he sounds as though he has some few social supports, but at least at this point he's receiving unemployment and has health insurance.
Why don't you proceed to your diagnostic impression?
On axis 1, major depressive disorder, severe. Sounds like he did have an episode before, recurrent with psychotic features. Sounds to me that the psychotic features are associated with his depressed mood, but it is difficult for me to tell. So I gave him also a rule out of schizoaffective disorder. He says that his mood was well, but still I'd like to go over that some more in the past year. So I rule out for dysthymia, and that's what I'm ruling out on axis 1.
Anything else?
I considered a psychotic disorder. I guess I could rule out a delusional disorder. It seems like a delusion, a persecutory type delusion, but within the context of his depressed mood, I attribute it to that, but that would be something else I might consider.
How would you differentiate that criteria-wise from a thought disorder?
Well, delusional disorder is usually a fixed delusion that's absent of a severe decline in functioning. There can be decline in functioning around the delusion. For example, increased delusion about a spouse cheating on somebody, and so there might be increased strife, but not the overall decline that he's experienced in his level of functioning, which I relate to more of the depression.
So your number one diagnosis on axis 1 would be what?
Major depressive disorder, severe recurrent with psychotic features.
And can you give us the criteria that he's given you in this interview to meet for that diagnosis?
He's met all the criteria: greater than 2 weeks duration. He's got the sleep. He's got the neurovegetative signs, sleep and appetite. He's got the decreased energy level, decreased interest. He does get some pleasure from playing the video games, but that's actually declining as well.
What about for axis 2?
Axis 2, I can't make a diagnosis in this limited amount of time that I've had with him, but based on his behavioral patterns, I would wonder about rule out of schizotypal type traits.
What other information would you need to rule in or rule out that diagnosis?
Well, I think it would be very difficult to really determine that diagnosis without an interview of his family. See if his kind of fantasy world has really been an impediment to his socializing, or rather kind of a retreat from his socializing, and has not been able to have good friendships and so forth throughout the years. It's definitely a source of comfort for him to retreat into this fantasy world.
Continue.
Other concerns that I would have is that he has a social phobia. I didn't ask him about that level of anxiety with socialization, but he denied any anxiety disorders. So, on axis 3, I'd give him a diagnosis. He has hypertension. On axis 4, occupational, and primary support group. His parents are alcoholics, and they're the ones sounds as though they might be alcoholics, and they're the ones he relies on. Axis 5, his current GAF is about a 45.
Okay. And can you give us a psychodynamic formulation of this patient?
Basically, he's a 40-year-old male who has a history of family history significant for alcohol abuse and/or dependence, anxiety. He has been treated for depression himself on fluoxetine, 20 milligrams. I didn't ask him about prior medication trials. I would definitely look into that some more to determine his treatment. But anyway, he's on fluoxetine. And he has had therapists in the past, but not currently, and he sounds like he's withdrawing mostly rather than using active coping strategies to get himself a job and things of that nature. And he has poor social supports and is currently, but does have, again, his financial situation is at least not deteriorating, and he doesn't have any problems with health insurance.
If you had more time with this patient, what would you want to ask him?
I would definitely want to ask him more of his prior treatment history. See what medication trials. I mean, I'm glad that he sounds like he's willing to continue with the medication, but see what other medications he's been given in the past. This might be also important for me to get an idea of if others had concerns of psychotic symptoms with his prior depression. Then I'd ask him a little more about his basically his history. Again, his social history would be very interesting to me. and any more details about that hospitalization and psychiatric hospitalization, whether there's any loss or anything else associated with that, what precipitated that.
Anything else?
I would interview family. I'd ask about any other physical symptoms that we didn't cover, if there's anything else that's changed. He has had the weight loss, so I'd want to be sure there's nothing else going on, talk to his primary care doctor, and again, with my review system, ask him if there's any kind of neurological changes, sensory changes, or anything else.
What would you be looking at with those sorts of questions? What were you looking for with sensory changes?
Just any kind of neurological signs that there's anything else that might be going on.
Is there a specific diagnosis that you would be looking for with that?
No, not really.
Can you move on to treatment? If this was your patient, how would you, if you were taking care of him starting today, how would you proceed?
The other thing is, I did ask him if he had any side effects, sexual side effects, something that sometimes people are uncomfortable telling about, so I would definitely look into that. He, on the fluoxetine, the way I would proceed with this patient is to have him come in for a second visit. Hopefully he'd become more comfortable with me and just review again his level of anger. I am concerned about his level of feeling like as though he's been wronged in a paranoid manner from his previous employment. I did ask him about any fantasies, any revenge fantasies, but that's foremost on my mind. Is he spends time on the computer, any other kind of sites that he might be exploring.
So what would you be asking him in that avenue?
About the computer usage?
About the revenge and the computer usage, those sorts of things.
Does he ever feel like he's getting revenge on the computer, ever contact anybody else who's feeling this way about a previous employer, any kind of fantasies that he's living through that way, any interest in firearms? I would ask him if he has any firearms, that sort of thing. It sounds at this point that he has no interest, but they do live nearby. He has easy access to these people. So again, concerning.
How would you rate his risk of harm to others right now?
I would say it's hard for me to rate it because I didn't ask him much about an aggressive past.
So if you had more time, what would you ask him?
When's the last time he got into a physical altercation? When's the last time he's threatened anybody? Signs that he's more impulsive with his anger.
So given the information that you have from the interview that was conducted, where would anything about that is
I would say it's low, moderate range. He's had 3 to 4 months. He wasn't impulsive about doing something at that time. He has no plans at this time. As far as I can tell, it would be low, moderate range.
What about risk of harm to self?
Well, he's got a past history of suicidal ideation, but not a past history of a suicide attempt. So it makes it more difficult to figure out his risk because there's no actual attempt. But I would say it's, again, probably low, moderate because he's so depressed. I don't like the fact that he drank with his family like that. Again, some disinhibition there.
What do you make of that? What are your concerns around that?
Well, it seems to be contextually dependent on his parents. So I think he's using poor coping strategies by drinking with them. but it didn't seem like it was outside of that. So I think that's, to me,